Hello everyone, my name is Debasmita Saha, Assistant Professor, Department of Trauma Care Management, Yenepoya School of Allied Health Sciences. Today we will discuss about snake bite. So at the end of the session, students will be able to state about snake bite with some common venomous snakes in India. They can distinguish between neurotoxic and hemotoxic snake bite, list down clinical features of snake bite, explain pre-hospital approach with point of care for snake bite. They can describe the assessment and management for snake bite in hospital setting. Now, introduction. Snake bite account for significant morbidity and mortality worldwide. There are approximately 3000 species of snakes, of which some 600 are venomous but only 200 are considered to be medically significant venomous. Common Indian venomous. Under that, two types, neurotoxic and hemotoxic. Under neurotoxic, Indian cobra and common krait. Under hemotoxic, Russell's viper and saw-scaled viper. Now I will discuss about neurotoxic versus hemotoxic. In general, the elapid venom comprise toxins affecting the nervous system and are considered as neurotoxic. Mainly, they are affecting patient's central nervous system, while the action of vaporate venom is directed mainly on blood coagulation and they are regarded as hemotoxic. They are affecting patient's blood circulation. Now we will discuss local and systemic clinical features of hemotoxic and neurotoxic. Under hemotoxic, nausea and recurrent vomiting, painful progressive swelling, bleeding from any body or orifice, mainly from the bitten side, ptosis when the upper lid fall over the eye, mainly in Russell's viper, epistaxis or nosebleed, hematuria or blood in urine, shock, bilateral parotid enlargement, local necrosis, and lastly acute kidney injury. On the other hand, due to neurotoxic snake bite, 5D and 2Ps are main. 5Ds are diplopia or double vision, dysphagia or difficulty of swallowing, dysgeusia or altered taste, dysphonia or disorder of the voice, dyspnea, shortness of the breath. And the 2Ps are ptosis and paralysis. Along with that, painful lymphadenopathy, palpitation, breathlessness and chest pain. And last not the least is broken neck sign. When the paralysis of flexor muscle of the neck happen and it can result in respiratory failure and lastly death also. Now, pre-hospital approach. When managing a patient with a suspected envenomation, the initial care to assess ABCs, assess the bite site for signs of envenomation including erythema, swelling, ecchymosis, tenderness and the development of blister or soft tissue necrosis. Now, snake bite point of care, what we should do, what we shouldn't do. First, reassure the victim, remove anything tight from around the bitten part. If the bitten part is upper extremities, remove any accessories like rings, watches or bracelet. If the bitten part is lower extremities, remove anklet, shoes and socks. Immobilize the person completely. Never use a tight arterial tourniquet because later it can lead to necrosis of the limb. Avoid traditional first aid methods, herbal medications and other unproven or unsafe forms of first aid. Closely monitor airway and breathing and be ready to resuscitate if necessary. Transport the patient to a healthcare facility as soon as possible. Now, snake bite initial management. Wash the wound thoroughly with distilled water or normal saline water if available. If not available, you can use clean tap water also for clean the wound. Apply an elastic bandage or pressure immobilized bandage to slow the spread of venom through the lymphatic system with the help of splint like when we do in a fractured limb. Now snake bite management in hospital setting. Initial management and stabilization focusing on ABCs. Prepare the resuscitation trolley if needed. Check for respiratory insufficiency. For that, we have to ask the patient to take a long breath. By holding the breath, the patient have to count from 1 to 30. If the patient is able to count from 1 to 30 without any difficulty, then there is no problem. If the patient is unable to count and the count rate is less than 20 or 15, that means the patient is bitten by a neurotoxic snake. On the other hand, we have to check 20-minute whole blood clotting test if vibrate bite suspected. For that, we have to take 2 to 3 ml of blood in a clean glass container. Without shaking it, we have to keep aside for 20 minutes. After 20 minutes, if blood coagulation happen, that fine, no problem is there. If there is no blood coagulation, that means the patient is bitten by a hemotoxic snake. Snake bite management. Before advanced management, we have to administer 0.25 ml of adrenaline in both hemotoxic and neurotoxic snake bite for preventing anaphylaxis. In hemotoxic snake bite, if 20-minute whole blood clotting test confirms vibrate bite, start 10 vial of anti-snake venom diluted in 100 ml of normal saline for 1 hour. Repeat 10 vial anti-snake venom if active abnormal bleeding persists after 30 minutes of first dose. If blood is not clotting in second 20-minute whole blood clotting test, after 6 hours, consider 10 vial of anti-snake venom rapidly. Consider urine output and dialysis if situation demands. Discharge only when the kidney function is stable and the patient is completely cured. On the other hand, in neurotoxic snake bite, start with 10 vial of anti-snake venom, again diluted in 100 ml of normal saline for 1 hour. Also administer atropine and neostigmine. If no neurological improvement after 1 hour of anti-snake venom administration, infuse 10 vial of anti-snake venom rapidly. Consider repeating atropine and neostigmine again. If still no improvement 1 hour after second dose of anti-snake venom, consider endotracheal intubation and ventilate the patient adequately. Discharge after total neurological recovery. Now summary. The 4 venomous snake that also called Big 4 are Russell viper, common krait, Indian cobra and Indian saw-scale viper. In case of snake bite, apply an elastic bandage or pressure immobilized bandage to slow the spread of venom. The 20-minute whole blood clotting test or 20 WBCT is a bedside test for detecting coagulopathy after snake bite. Ptosis, hoarseness of voice, choking throat are early neurological signs. Anti-snake venom is indicated depending on the envenomation and the type of snake bite. If tourniquet is placed already, removal should be done with caution and only after initiation of anti-snake venom. Terminate anti-snake venom drip in case of adverse reaction. These are some reference. Thank you.